dark circles under the eyes, ear itching. Anybody? Hey, you ever catch somebody doing this? Delayed food allergies. Okay? Asthma, like we talked about, acne, aches and pains that come and go for no reason, especially joint pains. And that's for my senior population. It doesn't have to be like that if you understand what you're doing. Let's go to the next slide. Anybody want to have some fun?
Me.
Okay, I'm all for fun, all right? You see in these slides right here, can you see the puffiness underneath the eyes? It's a little hard. I know we got, is there a way to turn it? Can I get 2 minutes? You got 2 minutes?
Yeah, 5 minutes.
Oh, I got 5. All right, don't give me 5. Can we turn the lights off just for a second? There are eyes. Hey, we're in the house now. So, everybody, you see the puffiness underneath the eyes. What's the tendency in our society? Our tendency in our society to say, well, they're just not sleeping enough. Right? Okay, I'll give you that. Maybe they're not sleeping enough, though, because they don't feel good. And maybe they're not sleeping enough because of what they eat. What you have to understand is, right below the eyes, they're very fragile, very thin capillary beds, very thin blood vessels, very susceptible to damage from minute things, like inhaling too many chemicals, like eating foods that don't work, okay? Does everyone think you can look at that, easily identify that? You ready? All right, let's have some fun. Find a partner. Let's see what we see. Find a partner. What's so nice about this test is it's not just, here's a list of foods, stay away from them. It's, here's a list of foods, these are stronger, these are moderate, these aren't so much. You can figure out what the big players are. For me, it's certainly yeast. Right on the money.
And coffee.
I don't drink coffee, which is crazy.
I know that.
No, seriously, I don't. I don't drink any coffee. But I called the lab on this on Tuesday, and I said, hey, what's going on with that? You know what they said?
What?
Cross-reactivity with yeast because of mold on coffee. Did you know that you can actually, by inhaling coffee, aroma of coffee, start an immune reaction? How cool is that, right? I mean, it's good to know, right? Okay, let's go to the next slide. So, let's go to the next one. So, sum it up. Let me sum it up for you, because I know I got to go. Get out of here. I got to go. What do you need to know as a consumer, and hopefully for many of you as future naturopaths? Number one, pick the right test. That's an IgG panel, not a complement or a skin scratch or anything like that. Pick the right test, IgG. If it doesn't say IgG, it's not the best that we know of today. Number two, know the right company. Just because the company does an IgG test doesn't mean they're good. SnoreQuest is starting to do IgG. I have no confidence in that. Allotest out of Boston is the best right now, from our opinion. There are a couple other really good companies, Immunolabs, US Biotech, but Allotest gives our patients the strongest thing that we can. Number three, get the right interpretation. I've seen patients go in and a doctor will mistakenly wipe everything that shows up off the board. You're trying to kill the patient. Now they're like, I can't eat anything. But you lost weight. No, I can't eat anything. And make sure you get the right naturopathic doctor. MDs are not trained in this, unfortunately, yet. I hope this changes. Get the right naturopath. This school is producing the right naturopaths. People who know how to do this. My clinic, I've trained all of my doctors in there how to interpret this test. This is my livelihood. Okay? I teach holistic nutrition for a living. I've designed a huge curriculum online and on campus for this. This is what all of my students, and some of them thankfully came today. They'll tell you. They've seen the changes in their body. All they need to do is follow the game plan. But a lot of it comes with knowing which foods are medicine for your body and which are poison. Okay? Let's go to one more. So, how do we say this together?
Yes, when you know.
I liked it. It was good.
But not good enough.
And we'll let it pass for today. Let's go one more. So, if you want more information about Genesis Healing Centers, myself, if you want to come in and work with me, we have a special starting next week for everybody that mentions the Discovery Day. First visit, $99. That's about $100 to $150 savings for new patients, but you got to schedule it by next week. Okay? We also have a program specific for delayed food allergies. If you don't need medical help, but you just want to know your delayed food allergies, call that number. We'll bring you right in, and we'll get you set up to have a delayed food allergy test done, and then an hour-long follow-up with a certified trained physician to be able to break down exactly what your perfect diet is supposed to look like.
That's another allergy.
No, that would be a separate one, but call the office and she'll give you all the specifics on it. We want you to get this test because we've seen this test work. Okay, so whether you're coming in to work with us as patients or, hey, I just want to know, come in and see us. We will help you. Okay? One quick question that I got to run. It is not. Is he calling you Genesis too? It's my name. I'm very, no. That's great. No, we're not affiliated. Okay? So, everybody, thank you very much for your time. You got a great